pivot out from telehealth to a broader conversation about priorities for health reform. And right now on Capitol Hill, there is a significant debate over what does it mean to make healthcare more affordable, more accessible, more equitable. When you are looking at the priorities that are being discussed, whether Medicare expansion, Medicaid, and so on, what are those key priorities, doctor, to making healthcare more affordable in America?
Yeah, as a starting point, Dan, at the Robert Wood Johnson Foundation, we believe that healthcare access is a right. And there are many ways to get to universal healthcare coverage. But if we can agree that everyone should have access to high quality, comprehensive, affordable healthcare, then we can work together to figure out, okay, how are we going to get there? Right now, there's a lot of discussion around what's called the Medicaid gap. When the Affordable Care Act was passed, it provided resources to states to expand those people who had access to Medicaid, which Medicaid in America is the largest health insurance provider. It provides care for low-income individuals. It provides care for people with disabilities. It's the largest provider of nursing home and long-term care for the elderly. And in the Affordable Care Act, it allowed states to expand the income requirements for Medicaid. So that meant that more people could get covered. And 38 states said, great, this is incredible. We want to give more coverage to people who live in our state. 12 states have not done so. And when you look at those states have 2.2 million people in them who would get health care coverage if Medicaid was expanded. Disproportionately, this is affecting people of color. In America, 15% of the population are Black. 28% of the people who are affected by what's called the Medicaid gap are Black. In America, 18% of people are Latino. 28% of people affected by this Medicaid coverage gap are Latino. And if you think about it, if in America there were a group of states that were saying we're going to withhold food and we're going to withhold water from a segment of our population, we would look to the federal government to say that's unacceptable. We're going to step in and fix it. Yet we accept 12 states in our country saying we are not going to provide health care coverage to people who live here. And it's time that the federal government takes this on and solves it so that 2.2 million people can get this care. Because the studies have been done to show the impact of this. When you expand access to health care coverage, you improve the health outcome, which is something you would expect to see there. You improve the longevity of life. You improve the economy. If people are spending less money for their own health care, what you see is that they have more dollars to spend in the local economy. And so that's a boom as well. One of the things we've seen in COVID, but it translates even in non-pandemic times, is that if you don't have health care insurance, you're going to wait longer to come in for care. And if you do that, it means many times that your disease has progressed. You're someone who has a slightly high blood sugar, but you don't go in to get it checked. When you do show up in the emergency room because you have full-blown diabetes, your prospects aren't as good. Same thing for getting your blood pressure checked, for getting your routine screens, for developing a trusted relationship. Those things all really matter. Representative Underwood was talking about maternal health care in America. And in America, the prospects for Black women and white women are extremely different. In our country, the chances that a Black woman will die during pregnancy or from pregnancy-related complications exceeds that for white women by twofold. The chances that a Black woman will lose an infant in the first year of life double again. And when you think about it, we do provide a lot of Medicaid coverage for women when they're pregnant. But you want to make sure that a woman is coming into pregnancy healthy. And to do that, you have to expand Medicaid. That's one of the ways to do that. But the healthcare crisis in America is not limited to Medicaid. When you talk to people who have health insurance, over the past decade, people have seen the amount that they have to pay, their premiums going up. You've seen their deductibles, the amount that they have to pay, they have to cover before their insurance kicks in, is going up. So we have a healthcare crisis in America, and it's time for the federal government to fix it.